Hey, I'm Dr. Jamil Smith, lead pediatric psychologist at Wayne Pediatrics. Welcome to our very first show of Detroit Peds Talk. I'm pleased to have with me today my colleague and guest, Dr. Laura Benjamin, who is an adolescent medicine specialist. Today, we're discussing sexual health and adolescence. So, Dr. Benjamin's welcome. Tell us a little bit about what is sexual health.
Thank you so much, and good morning, everyone. I'm so happy to be here and so grateful that we're starting the conversation about this very important topic. Sexual health really is about well-being, and it's really fundamental, not only to individual health, but to the health of families, and can even impact communities in a larger scale. So I think it's so important to begin these conversations early. And it's not only about the absence of disease, but it's learning about what's normal, what's expected as far as our bodies, the changes that it goes through. And it's about learning how to express ourselves in the absence of fear and being respectful of our bodies and of others.
Yeah, this idea that it is normal, right? That sexual health, conversations around sexual health, awareness of sexual health, these are all ideas that are a part of the normal development of young people and human beings. And so it's important that we give it the attention that it deserves. So, what are your thoughts about what parents can do to support their child in cultivating good sexual health?
I think it's so important to lay the foundations early of having a good relationship with your child. And that means open communication, making your child feel safe and free of being fearful of asking questions. That means letting your child know that they can ask whatever they want without worrying about getting in trouble, that you are there for them as a parent to support them. It's also really important to be able to provide information that's accurate and in that safe environment. So I think it starts with early on establishing that relationship with your child of open communication. And then as your child grows up, just being observant and being in tune with what your child is going through, starting to notice when their body is changing, starting to notice when they're interacting more with their peers and what those conversations are like. So just, really being present for your child and being part of their life. There's so much information out there that children will get from their friends or from the internet. And so ensuring that you are there for them, providing them that safe environment and that accurate information is just really key.
Yeah, you point out communication and establishing good communication in that parent-child relationship is just so important, right? Because it lays the foundation not only to discuss sexual health and questions about sexual health, but it just allows us to be able to communicate with our kids in ways and talk about things in ways that feel supportive. And so being able, even when they're little, to have good conversation, right, sets us up to have these conversations so that they can feel like they're developing into a good sense of self and independence when they can feel like they can go to someone to these conversations. Where can parents or teens even turn if they have questions or want more information?
That's a great question. And I think when you're bringing your children to the well child visits, utilizing your pediatrician can be really helpful, especially a lot of us grew up in families where sex was not talked about. And so it can make it even more uncomfortable if, we weren't raised with that being part of the conversation. So asking your pediatrician for help. Myself as an adolescent medicine physician, I start seeing patients around the age of 9 or 10, which is when a lot of children do enter the beginning stages of puberty. So, if you have an adolescent medicine physician available to you, if you're coming to Wayne Pediatrics, I'm certainly happy to be a resource. But also in the visits that I have with families is I usually start by finding out where they are in terms of their knowledge and what discussions they've already had. So I frequently will ask the patient, what do you know about puberty? What do you know about how your body's going to change? I'll ask the families, what discussions have you had already? And kind of figuring out where they are at that point. I do offer other resources, both online and in terms of books, that I think are really helpful too, if parents feel really stuck, kind of not knowing where to start. I really like Young Women's Health as well as Young Men's Health site on the internet. I tell my families and my patients that these are internet resources that I know are accurate, that have been designed specifically for teenagers and young adults and even tweens, those just entering puberty. And it's very reliable, accurate information, and it's a safe place to get information. In terms of books, there are several that I really like as well. The American Academy of Pediatrics just came out with a book called Uology, which was specifically designed to be very inclusive. I've also used a couple books in the past for girls called The Care and Keeping of You, and then the same author wrote a book for boys called Guy Stuff. I often will give these books out in clinic, especially if families haven't really just started the discussion yet, because they're fun. They address a lot of different situations and how to handle them, but also it's really focused on being respectful about your body and knowing that these changes are normal. And so that's why I really like those resources.
Yeah, I love how you highlight in the visit a way to open up that conversation for both the patient and the parent. It's really helpful to know that parents don't always have to have all the answers, and that pediatricians like you can help bridge the gap where they're feeling uncomfortable or unsure with good knowledge to facilitate just good overall health as well as support in their child's sexual health. We'll have
Absolutely.
links to those resources, right?
Yes.
On so grateful for the work that you do.
Well, thank you. And I think what you talk about in terms of providing information, that's so key to empowering our children to make healthy decisions. I know a lot of times families get scared. They think, oh, if I bring this information up, it might encourage my child to do certain behaviors or act out in certain ways. But research has really found that the more information you provide, the more you give your child a chance to kind of make those decisions, the more likely they are to actually make those healthy decisions. So information is so powerful.
Right. And I often tell parents and emphasize that, it's okay to have these conversations in the space of feeling unsure and uncomfortable. It's almost better to engage in this and sort of fumble along with good information than to avoid the conversation altogether. As parents, none of us have all the answers, but we know that. You say, having that conversation and providing the information empowers them. It helps them to develop that overall sense of self that is a natural part of their. And especially, I find that, with patients who are exploring sexuality, sometimes it's difficult. Some parents are uncomfortable and avoid those conversations. And leaving the door open, whatever your values, whatever your thoughts, to have that ongoing conversation really does support their overall well-being and mental health. So, yeah, I think that that's really important. Well, Thank you all for joining us today for Detroit Peace Talk. For more information about Wayne Pediatrics or Dr. Benjamin's, visit waynepediatrics.org and follow us on Instagram and Facebook for new shows posting monthly every Wednesday. And remember, pediatricians are the best option for the medical needs of children. Take care.
Thank you.